first way is through the air. So we know that the virus is aerosolized and it can get into the body through mucous membranes. And our eyes actually have a mucous membrane on the surface, so it can potentially get in through that way. The second way is through tears. So in people who are infected, virus particles have been found in their tears. Not everyone who's infected, but a subset. And so basically, if their tears are, if they rub their face and their tears get on their hand and then they touch something, then they can contaminate the surface that they touch. For example, if it's a doorknob or a faucet, it can get contaminated. And then those are really the two ways that the virus can spread through the eyes.
Can we get viruses by touching our eyes?
Absolutely, yes. So that contact can definitely spread viruses. And this is a particular concern, now it's allergy season, so many of us may be wanting to rub our eyes. We have to be very, very careful. If you do have to touch your eyes, make sure you absolutely wash your hands first. The other concern is for people who wear contacts. So they end up, touching their eyes much more often than other people would. So putting them in, taking them out, make sure you wash your hands. And for some patients, I actually recommend switching temporarily to glasses, just so that that need to touch your eyes is just not there. And the other added benefit of glasses is that it provides a protective covering. So you don't necessarily need to wear safety goggles or face shield. If you're wearing glasses, that will potentially protect that aerosolized virus particle from getting to your eyes.
They talk about wearing masks, but they don't talk about protecting the eyes. So, sunglasses when we're outside are certainly an extra layer of protection.
Absolutely. And I would say for most people, that's sufficient, either sunglasses or glasses. Now, if you're a healthcare provider, or if you're on the front lines, a first responder, absolutely, you need to wear the full protection because the viral load is so high.
Let's talk about routine eye visits. I'm sure that, like most healthcare professionals, eye doctors are considered essential. But is it safe to go for a routine visit right now? Should we be doing that?
So actually, our society, which is the American Academy of Ophthalmology, put out a statement last month, and they recommended that we cancel all of our elective visits and surgeries for the next 2 months. So that means that most eye care providers, both ophthalmologists and optometrists, their offices are probably closed for routine visits. We are open though for emergencies. Absolutely. If you have an urgent issue, if there's a change in your vision that's urgent, or if you've had some injury, definitely call because we're available for that. But for anything routine, we are putting that off for at least 2 months.
But many ophthalmologists, though, are, like you mentioned, on call. So if we think we're having some sort of eye emergency, we can call and certainly find out if it's something we need to be seen for.
Absolutely. And many of us are doing telemedicine visits, myself included. So there is that option as well. So if you really need to speak with your eye doctor, reach out to their office, maybe schedule a telemedicine visit. Or if you really do need to go in, if you go into the emergency room or an urgent care, then they will probably call the ophthalmologist on call. So there's that route as well. So we're always available.
Are we risking some eye strain? We're watching more TV. We're looking at screens more than anything, more than we have in a long time. Are we risking some eye strain here?
So that's actually my bigger concern in terms of COVID-related eye health issues, is the shift towards more digital screen time use. And before this all happened, we were spending a lot of time on our screens anyway. So the average US adult was spending about 11 hours a day in front of a screen. And even kids, many kids were spending about 6 hours a day. So those numbers are just going to skyrocket during this pandemic. And the concern is really the blue light that's coming from these screens. So screens emit this short wavelength, high energy light that can potentially cause issues. Nothing long term, for example, it's not going to lead to blindness or anything like that, but certainly it can cause short term issues like trouble focusing, blurry vision, dry eyes, light sensitivity, sometimes even headaches. And in some people, it can interfere with their sleep patterns because too much blue light, especially towards the end of the day, can make it more difficult to fall asleep or to stay asleep. And there's also concern about blue light in kids. And the reason is because kids' eyes perhaps don't filter out as much blue light as adult eyes do because their eyes are still developing and growing. And so, with kids, there's some early research that shows that kids who are exposed to too much blue light may actually have behavioral issues like hyperactivity or attention issues and even cognitive issues. So there are all these concerns around blue light and our eyes.
How can we help that or prevent any sort of short-term or even long-term issues?
Yeah, that's a question I get very often from my patients. You know, what can I do about this digital screen time? And so many of my patients ask, should I be wearing blue blocking glasses? And my response is, actually, there are some better ways to protect against blue light than simply wearing blue blockers. Now, our nature has actually provided our eyes with internal blue blockers. We actually have these amazing pigments in our retina, and they have pretty fancy names called lutein, zeaxanthin, and mesozeaxanthin. It's a mouthful to say, but these pigments are in our retinas. And they actually absorb that blue light and neutralize it and prevent it from doing us harm. And the best way to get these nutrients, these pigments, is through our diet. So for example, vegetables and fruits, green leafy vegetables and orange and yellow fruits and vegetables are high in all of these pigments, these nutrients. But unfortunately, most of us who are on a Western diet just don't get enough of those nutrients in our diet. And in that case, it may be best to supplement. And there are specific supplements that are great for blue light. There are many on the market, but there's a particular ingredient that actually includes all of those three pigments that I talked about. And that ingredient is called Lutamax 2020. So if you're looking for an eye health supplement or a blue light supplement, look for that label and look for Lutamax 2020 because it'll already be in there. And it's something that actually I take myself, I have my family take, I recommend to my patients, and it's actually I'm writing a book on macular degeneration. It's in my book as well, because I've done a lot of research in this area, and that's really what I found to be the best out there.
So for people who want more information, tell us where they can find your book and where they can find out is their website, or they can find more information about some of your research and what you recommend.
Oh, thank you. So my website is probably the best resource. It's my full name, which is ranibanikmd.com. But I'm pretty active on social media as well, on Instagram at dr.ranibanik and Facebook as well. And my book is coming out soon. And so if you follow me on social, I will provide you with updates on when my book's going to be coming out.